Lisa, Amanda?
Thank you, Sabrina. I think Amanda may be starting us off with the first couple of slides, but we're so excited you guys are all here today. So let's go ahead and go on to the next slide.
Great, thanks. Yep. So we are going to try and answer a lot of these great questions that you guys have been throwing into the chat right when we kicked things off. So we're going to talk about kind of recognizing anxiety, what we understand about anxiety in this population, and then a little bit about how we screen for it, and lots about how we treat it and address it. So next slide. So starting off, just thinking about what we're meaning when we say anxiety, right? So there are lots of different words that can describe anxious feelings, right? So maybe it's fear, worry, it could be a sense of dread or just this unease, like there's something not quite right. And there's a degree of anxiety and fear that's actually healthy and protective. We should be fearful if there's a wild animal too close to us. Those are situations where we should have a degree of fear and anxiety. But next slide. At times, anxiety can get to be too much, and that's when we start to think about these words disorders or calling it an official diagnosis of anxiety. So really, we think about an anxiety disorder diagnosis when a child's symptoms or when a person's symptoms are their worries or their fears or their sense of dread is really persisting or getting worse. And particularly if it's starting to get in the way of their ability to function, to learn, to participate in day-to-day life. And anxiety symptoms, a lot of people asked about, what do you do if a child can't tell you how they're feeling, right? So sometimes there are some physical symptoms that might be a sign that a person is feeling anxious or worried. So they might have a faster heartbeat than usual. They might start to sweat a little bit. They might tremble or shake if they're particularly fearful. And sometimes people might present with symptoms of sleep problems or tummy aches or other GI sorts of problems, appetite changes, even sometimes bowel habits can change when a person is feeling particularly anxious for longer periods of time. Next slide. And anxiety can present in a couple of different ways, right? So there are externalizing anxious behaviors. So sometimes when a person is feeling anxious, a child might tantrum, or they might be more argumentative. They might be more cranky. They may get more repetitive in their behavior. So they may ask a question over and over and over again because they're worrying about that particular topic, or they might just refuse to participate or do what it is that you're asking them to do. And in some cases, if a person is feeling particularly anxious in a certain situation, they might just decide to leave. So in little kids, that can look like elopement from the classroom or from the activity. And then there's internalizing anxiety behaviors. And that's when maybe the person might just be more withdrawn. They might say that they're worrying. They might look more sad or more distracted. And you may see some of those kind of subtle medical things like an appetite change or a change in their sleep patterns. Next slide. And what we know about anxiety in people with autism is that autistic people have higher rates of anxiety symptoms, depending on the study that you look at and the group of people that they were asking these questions about. Anywhere from 20 to 80% of people across the age range with autism will also have a degree of anxiety symptoms. And when we looked specifically at children in this population, it's right around 40% that will also present with anxiety. And sometimes it can be a little harder to recognize that a person is anxious, particularly if they're minimally verbal and they don't have the language to be able to tell you how they're feeling. And the other thing that makes anxiety a little bit tricky is that sometimes anxiety and autism symptoms can overlap and look a little bit alike in certain ways. Next slide. And so This slide is a way of just kind of looking at how much overlap you can actually see between these two diagnoses. Autism and anxiety are not the same thing, but they do share some similar features sometimes in people. So an anxious person might be a little bit socially avoidant in some situations. They might be a little uncomfortable with conversations, particularly with groups of people or new people. They might be a little more rigid about their routine because if something is predictable for them, it makes them feel less anxious. They might obsess. They might think obsessively about something that they're worrying about. And sometimes if people have obsessive compulsive types of behaviors, they might act out repetitively and in certain ways to act through those compulsions that they're thinking about. They may be overly sensitive to things in their environment because they're just feeling more nervous or worried. And a lot of times people with anxiety might have just generally more negative thinking. So they tend to have a more negative outlook on the world. People with autism also tend to have some social communication difficulties, so they may not always be comfortable in certain social situations. They like things to be predictable, so they might have trouble with transitions and have a preference for things to happen in a routine. They might have really strong interests that they think about and talk about a lot, so it might look like they're obsessing. And they might have repetitive physical behaviors or behaviors with objects that might look like a compulsion. People with autism sometimes can have some sensory differences. They might be overly sensitive to things around them, or they might seek out certain sensory input. And there's higher rates of irritability and negative behaviors in people with autism. Not everyone, but some can have more irritability symptoms and more tantrums. And so there is some confusion sometimes about whether a symptom is just part of the autism or maybe a sign of anxiety. Next slide. And to complicate things further, there's been some research that's looked at autistic individuals and their very specific types of anxiety that they might have. And there's this term called atypical anxiety. So this is anxiety symptoms that people with autism might be prone to having that are maybe a little bit different than your run-of-the-mill anxiousness. So they might worry about the routine or about something new or about a particular restricted interest that they have. They might have a very unusual fear. So I've had patients that are afraid of the happy birthday song or afraid of babies crying. I had one patient that was afraid of trees. And so they might be these very circumscribed, specific worries that a person has. They might be anxious in social situations, but they're not anxious because they're worried about how people view them or think of them. They're just anxious because it's a social situation and they don't particularly enjoy that environment. And they may have some compulsive or ritualized behaviors, but they're not necessarily the traditional definition of OCD, meaning that they're acting out in this ritualized way because of an obsessive worry that they have. So those are some kind of unique versions of anxiety in the autistic population that we've seen and learned over the years. In addition to that, social anxiety that is not autism can have some kind of blurry lines in terms of how we make those differentials, right? So a person who has social anxiety tends to be overwhelmingly fearful or anxious in social situations. And people who have autism may also have social anxiety. In fact, the people that have more autistic features tend to have a higher rate of social anxiety symptoms. And so people that have more difficulty with their social skills might struggle with feeling anxious in those social situations, but they may not express it. They may not say, hey, this is hard for me. I'm uncomfortable or nervous in this situation. And they may not think to ask for help. Whereas another child or individual that's socially anxious would seek out help or guidance from an adult or a friend in those social situations. Next slide. So I think Lisa is going to take over here.
Sounds good. Thanks so much, Amanda. So now that we know what anxiety is and how it can appear in autism, it's important to understand how we can think about making this official diagnosis. When you're concerned that your child or family member may have anxiety, we'll talk a little bit about what to do next. Next slide. So anxiety is typically diagnosed by a mental health professional like a psychologist, a psychiatrist, or therapist, though other doctors like developmental pediatricians may also help to facilitate a diagnosis, particularly for individuals with developmental disorders like autism. Because anxiety can sometimes be hard to identify for all the reasons that Amanda just shared with us, we want to make sure that you know to trust your gut. And if your current doctor is unsure or unable to give you a definitive answer about whether or not your child may have anxiety, ask for a referral to a specialist. Next slide. A formal evaluation process for anxiety will likely include a visit with your doctor to review your child's specific symptoms of anxiety, things that you're noticing about their behavior, and the coping skills or strategies that your child is using when they feel anxious. So how do they respond when they're feeling anxious or nervous? As always, the more specific you can be, the better the doctor will be able to help you make an accurate diagnosis. So share how anxiety has impacted your child's daily life. For example, are there specific situations or activities that they're avoiding? Are they showing increased stress in certain situations, or have these challenges increased recently? So we saw in our case today, and lots of you had very important questions about the transition to middle school for Lucas and the increased time with grandparents, things like that. Next slide. Data collection is also a really important part of the evaluation process, and it can take many forms. Standardized data is helpful for clinicians and family members to talk through and review together. And we'll talk about some of these tools here. So you can see a whole long list of tools that are standardized assessment instruments that can be used to evaluate for symptoms of anxiety. But informal data is also really important and helpful for your doctor. So when you think about data collection, we want to keep in mind that these rating forms are helpful. Your doctor may ask you or your child's teacher or therapist, or even your child directly, if they're able, to complete some standardized questionnaires. And it's always best practice to collect information on standardized questionnaires from multiple sources so that we're capturing multiple perspectives. You all know that all of us and our children can look different across different settings. Next slide. This data collection process takes a lot of time and energy. So in order to make the most of these standardized rating forms, I want to share a few helpful tips for you to think about. So first, take some time to thoroughly fill out the forms. Don't wait and rush to fill it out right before your visit that morning when you're trying to feed the kids breakfast and get out the door. I want you to familiarize yourself with what we call the rating interval. So is the form asking you about your child's behavior and symptoms within the last week, the last month, the last 6 months? Make sure you're filling out your observations based on the appropriate rating interval. If you need to clarify your answers, feel free to add some notes for your doctor in the margins of your form, but try your best to select a response that most accurately represents your child's current behavior or symptoms, because if you leave too many items blank on any of these standardized questionnaires, your doctor won't be able to get a valid score to review with you. In addition, I want you to bring your expertise into the process. So for example, if your child is non-speaking and the form asks you about whether or not your child asks repetitive questions or verbally seeks reassurance when they're nervous, you might need to consider how your child seeks reassurance. Instead of asking repetitive questions, this could be repeatedly showing you a specific time or item on their visual schedule, something that they may be perseverating on that they're nervous about, right? So bring your expertise to the table. And finally, make sure to ask your doctor to share the results from each rating form with you. You and your child have the right to review and understand these results. And I encourage you to share your feedback with your child's doctor, especially when the standardized test forms or scores don't necessarily match what your observations or experience are suggesting. Next slide. Now, even still, with all of these standardized rating forms, they're not going to capture the full picture. Or they may ask you about a certain time period like the last week where your child's really been doing okay, when the month before was really challenging. So for all of these reasons, I really want you to make sure that you're sharing your informal observations about your child's symptoms and behaviors. What you see and live on a day-to-day and week-to-week basis is so important. You know your child best and you see them every day. So make sure that you're sharing those observations with your doctor. Sometimes parents and caregivers may track structured data on a specific behavior. For example, how long is it taking your child to get into the classroom each day for a school avoidant or anxious child? And other times, you might simply share some informal observations or take notes in your phone or in a journal or notebook and bring those to your appointment to review with your doctor. Next slide. All right. So finally, your doctor will determine if your child's symptoms meet criteria for a specific anxiety disorder based on the DSM-5, which stands for the Diagnostic and Statistical Manual. And this is really the book that defines for us all of our diagnosed mental health conditions. As you can see here, there are several specific anxiety disorders included in the DSM, ranging from things like separation anxiety to specific phobias or more generalized anxiety. And Amanda gave us a sense of what some of those things look like in her comments earlier. Once your child has a specific anxiety diagnosis, and you have that formal diagnosis, you're going to likely start to think about what you can do to help. So let's dive into that. Next slide. And one more. Thank you. So fortunately, there are lots of things that we can do to treat and support anxiety. We will be reviewing 4 main treatment options for anxiety today, including environmental and behavioral supports, parent training, cognitive behavioral therapy, and medication. And I know several of these topics came up in your questions at the beginning of our presentation. So hopefully we'll touch on some important information. Next slide. All right, so let's review a few environmental and behavioral supports. These are things that you can do at home, no appointment needed. They set your child up for less stress and lower anxiety. I want you to think about things like maintaining a regular schedule and routine for your child, previewing changes or transitions in that routine when something unexpected is going to happen. If your child's particularly nervous, you may need to preview that with them and let them know what's coming. Use social stories to prepare your child for new and upcoming events. And try your best to balance high stress and low stress activities so that you're not scheduling too many stressful or challenging things for your child to tackle in one day. Make sure to allow extra time to complete tasks and activities, particularly when you know that your child may be anxious. Rushing your child can work to increase their anxiety and make it more difficult for them to get through a particular situation. I also want you to think about providing frequent praise and reinforcement for your child's attempts at stressful and anxiety-provoking activities, and make time for your child to decompress and de-stress. So this sort of goes along with balancing your schedule, but make sure that you're building in some of these the time and space for your child to de-stress and use some effective coping skills to regulate themselves after stressful situations. And certainly don't forget about prioritizing your child's sensory motor needs. Again, if your child's sensory motor system is not adequately supported, they may be inclined to feel more stressed and anxious, right? So addressing that first and foremost can really help to alleviate some anxiety. Next slide. Next, we'll talk a little bit about parent training. And I know as parents, it's important for you to remember how much powerful influence you have on your child's life to help them face anxiety-provoking situations in adaptive ways. There are lots of things that we can do that either help make your child's anxiety easier to cope with or more difficult to cope with. In fact, anxiety in a lot of ways is a vicious cycle. So imagine if your child's nervous and your first instinct is to sort of rescue them and help them get out of whatever situation is making them feel anxious. But every time we avoid or run away from those anxiety-provoking situations, that response teaches our body that we must have escaped certain death, that we should have been anxious in the first place. And the next time we face that situation, we're going to feel even more anxious. So we really want to be mindful about the impact of our response when our child is anxious to help reduce their anxious response in the future. Next slide. So let's take a little look at parent training in action. Many children have significant anxiety around things like doctor's visits and medical procedures. We saw a few comments asking about this in the chat earlier today. And so I want you to think about these two scenarios. In option 1 versus option 2, from this example, it's pretty clear which option would help to reduce anxiety and promote future success with doctor's visits and blood pressure checks. You can see in option 1 that your child started a new medication and your doctor wanted to schedule a blood pressure check. So you take your child in for a quick check after school on the way home, but your child starts kicking and screaming and runs out of the office as soon as they see the blood pressure cuff, right? They're anxious and nervous. The consequence, your child didn't have their blood pressure checked, and they were able to leave the office without completing that step. They also got McDonald's with you on the way home because everyone was still stressed out and nobody had energy to make dinner, right? In option 2, you can see the same situation. You're starting a new medication and the doctor wants to check your child's blood pressure. But this time, instead, you preview the appointment. You create a plan for your child, maybe using some visual supports like a first then schedule or a social story. And you allow the child to explore and to practice the process of taking a blood pressure, right? Maybe with toys at home first, maybe exploring the real materials in your doctor's office. Your child is able to sit with this practice and this preparation. Your child's able to sit for the blood pressure check. They may be anxious, right? They may still have some rapid breathing or increased scripting, but using visual supports and breathing exercises and preferred activities, your child's able to complete the blood pressure check, and now you celebrate with McDonald's. So you can see these 2 examples are going to have really different impacts on future anxiety response in your child. Next slide. All right, so we had some questions earlier about what CBT is, so we're going to talk about this. Well, CBT is a very well-researched therapeutic modality that's effective in reducing symptoms of anxiety and building positive or effective coping skills. Next slide. Next slide. Thank you. CBT is based on the idea that how you think determines how you feel and how you will behave. So there are a few key elements to consider when we're using CBT for anxiety and autism. First, it's important to help a child with autism build their capacity for accurate emotion identification. This can be uniquely challenging because of some of the core symptoms we see in autism. We also have to address or challenge some of the irrational beliefs and automatic thoughts that come with anxiety. And we need to incorporate safe and supported opportunities for what we call exposure or practice in order to help a child build and implement more effective coping skills and problem-solving strategies. Next slide. So let's run through a couple quick examples here of what this might look like for you or I. For example, let's talk about the task of having to give a big presentation at work, right? In the first line, you can see that the automatic thought that I might have about this is I'm a terrible speaker. I always sound stupid. I'll probably lose my job, right? My emotional reaction is feeling highly anxious. I feel maybe an 8 out of 10 anxious if I'm rating my anxiety on a scale of 1 to 10. And so what do? Well, I call in sick on the day of the presentation. I get in trouble with my boss, but I don't have to give that presentation, right? I avoid giving that presentation. In the second line, you see the same situation. You have to give a presentation, but here we work to change our thought, right? So I can remind myself, I know the material, and I'll be able to refer to my notes if my mind goes blank, right? So you can sort of restructure some of your thoughts. I still feel anxious, but maybe a 4 out of 10. And because of this, I'm able to complete my presentation and get some good feedback from my boss and coworkers. Next slide. So how does this apply for our kids, right? What about a situation that a child might face? In this situation, a child loses their backpack on their way home from school. You could imagine that an anxious child might worry that mom's going to get mad or she'll punish you or take away your Xbox. So you start to feel anxious and angry, and you avoid mom, you lie to her about losing the backpack, blame it on another kid on the bus, right? In contrast, if we can change some of those thoughts and remind ourselves and help our child remind ourselves, mom cares about me and she wants me to do well in school. She knows the bus driver's phone number or the phone number for the bus yard. We can call and get our backpack back, right? Still feel worried, but a little bit more optimistic, and you're able to tackle that together with mom. So some really important examples here to help you think about how CBT, cognitive behavioral therapy, can be helpful in anxiety. Next slide. Now, certainly CBT requires significant modification for autism, and I'm listing a few of these modifications here. So it's really important that you're working with a therapist who's able to understand your child's specific cognitive, language, and social profile in order to effectively modify cognitive behavioral therapy for their specific needs. Next slide. We also want to think about how we prepare and structure sessions to make CBT as successful as possible. And we talked a little bit about making sure your doctor knows your child's profile. You can help with that by sharing evaluation reports and behavior support plans, by allowing your doctor to talk to other people like your teachers, therapists, or in-home teachers or in-home therapists. And we also want to think about the structure and format. What would be best for your child? Would they do better individually or in a group? Would they do better virtually or in person? Will they need more time in order to master some of the skills that they're working on in CBT? Next slide. In addition, when we're thinking about modified CBT, we need to think about how your child's core features of autism impact their treatment. So do they need some extra support building social skills and competencies in order to address situations or more successfully tackle situations that make them feel anxious? Do we need to specifically work on building their self-awareness and emotion identification skills? Or can we find ways to promote social engagement for anxious kids? Next slide. A few factors to consider. So for some children, we really need to support their cognitive and language needs very specifically. And you can see some examples of how we might do this with modifying the content to be more developmentally appropriate or placing more of an emphasis on the behavioral response, allowing extra time for processing and practice and plenty of opportunities for repetition. Next slide. There are also lots of things we can do to support engagement and motivation in treatment. So these would be things like involving your child in goal setting, incorporating special interests and affinities, using technology, and incorporating some reinforcement strategies and sensory motor breaks to encourage engagement. Next slide. As always, parent involvement is key. We talked before about how important your role is in getting an accurate diagnosis of anxiety, but we also want to make sure that you're involved in every session for treatment as well. It's important that you share your family values and cultural beliefs with your clinician so they can understand how that impacts your child's anxiety and how it might support some of their coping skills. Ask your child to teach you the skills that they're learning and take advantage of parent-only sessions where you might meet with the doctor or clinician on your own to learn about how they're helping your child master some of these CBT techniques. Also, feel free to ask for specific strategies that you can apply at home. For example, you may want to talk with your clinician about how to handle family members with different opinions or views on your child's anxiety. Different people in your life may interpret your child's behaviors differently. And so, it can be helpful to talk with your clinician about how you can advocate for your child who may be anxious and avoidant or overwhelmed in family situations. And last, but certainly not least, of course, we as parents can experience anxiety just like our children. And in fact, anxiety often runs in families. So it's really important to make sure that you're seeking individual support for yourself too. If you are an anxious parent caring for an anxious child, that will likely make everybody feel more anxious. And so if you find yourself feeling stressed and anxious, which many of us do, it's really important to do some work on your own. And the good news is we talked about some of our examples today, how CBT can work for us as well, for all of us. Next slide. I think we're just about to the end here and I'm watching our time as well. So you'll get this recording for this presentation, but I want you to think about how we plan for generalization of these coping skills. This can be hard in autism for a lot of different reasons, but planning for generalization from the beginning is really important. Incorporating real life or in vivo practice and exposures is also really critical. And then leveraging your partnerships with home and community-based providers who can help carry over some of the strategies that you might be learning and working on in modified CBT for anxiety. Next slide. I'm going to skip over this example for now, but we'll have the slide. You'll see this recorded. And the final slide here has a couple of evidence-based interventions, references for you moving forward. And the final slide after this that I'll talk about just has a few books and resources for parents. So please, I encourage you to take a look at some of these resources. It can be really difficult to find mental health therapists with expertise in anxiety and autism. So if you're having trouble accessing mental health counseling or CBT, take a look at some of these other resources like books, our toolkits, and parent training seminars that can help you learn new ways to support your anxious child while you're waiting to connect with a mental health clinician. Amanda, I'll pass it back to you.
So we're going to take just a couple minutes to talk about medicine for anxiety. You can go to the next slide. So one big question that comes up a lot, right? I'm a doc, I prescribe medicine. But I don't love doing that. And particularly for anxiety, there are lots and lots of behavioral strategies and lots of therapeutic approaches that have been shown to work really well. When it comes to treating anxiety, therapy is always going to be the first line approach. However, a high percentage of autistic people are taking medications for their anxiety. And there are times that medicine can be really appropriate to think about in conjunction with therapy. And the times that we think about adding a medicine to treat anxiety symptoms are really when those anxiety symptoms are getting in the way, right? If a child is so anxious that they're really not able to learn and participate in school, they're not able to participate socially, this is affecting their self-esteem or their quality of life. And in some cases, I've had patients where the therapist has said, we really aren't making as much progress as we could because the individual is so anxious that they can't even relax to participate and follow through with some of the activities that Lisa described that a cognitive behavioral therapy approach would cover. Next slide. So there are not a ton of approved medications for anxiety in children. There are just a few. Most of the medications that are used in the pediatric population to treat anxiety are being used off-label. They're medicines that are approved for adults who are anxious, and we use them in children. And in some cases, they've been used for many decades in children, but they've not been particularly studied. As I've said, and you'll hear me say it probably more than once, medications are going to be most effective when they're combined with a behavioral intervention. And you guys did a great job of asking about other medical things that might need to be addressed before we think about putting a child on a medicine for a behavior like anxiety. So all of these are things that we think about and that a physician that is thinking about prescribing medicine for a child or an adult with anxiety needs to consider. Next slide. So very quickly, next slide, we're going to talk quickly about the medicines that we use. So the most common medicines we use for anxiety are selective serotonin reuptake inhibitors, or SSRIs. There are a bunch of different versions of these medicines, and they all have similar sorts of profiles in terms of how they work. Some have been used in children more than others. These are the ones that I think are most often used in the pediatric population. Buspirone is an anti-anxiety medication that can sometimes be helpful, particularly if someone hasn't tolerated an SSRI trial. Sometimes we use antihistamines like hydroxyzine. Those can be helpful. They make you a little bit sleepy, so they can be helpful when kids are anxious and not sleeping well. They can also sometimes be used as needed for just short-term anxiety situations, and benzodiazepines, which we really try not to use too often, but can be particularly helpful for very specific situations that a person might be anxious, such as a dentist appointment or getting on an airplane. Next slide. In general, when thinking about medicines, right, a medicine for anxiety can make therapy more effective if therapy by itself is getting held up by the anxiety symptoms. In some cases, it might also reduce some irritability or agitation. In the SSRI class or the buspirone class, if they're taken every day, they can really sort of help take the edge off of those anxiety symptoms throughout the day. And others might just be used as needed in a situation where someone has a very particular source of anxiety. But on the con side, all medicines have side effects. I'm not going to cover all of those today because, frankly, you should be asking about them. Anyone that's putting your child on a medicine, you just want to know what are the potential things that might happen that we aren't hoping to see happen. They may also not address all of the symptoms. I usually will tell families the medicine's going to take the edge off of the anxiety, and then the therapy is there to help the child learn how to cope and manage those symptoms. And most of the medicines that we talk about for using for anxiety symptoms have really mostly been studied in adolescents and adults. We don't have a lot of pediatric data other than the clinical use that we're seeing in most practices. Next slide. So when you're thinking about medicine, or if a doctor is talking to you about medicine, ask questions. Ask what the doctor thinks the medicine's going to do. What symptoms does the doctor, what should you be tracking? What do you think is going to improve with this? What do I need to look for that might be a sign that there's a side effect or a negative effect from the medicine? Make sure that you really are clear on what you and the treating person think what the symptom is that you're trying to track to change. You know, a repetitive behavior that is part of the child's autistic features is not necessarily going to go away. But so it's really important to make sure that you know what it is you're trying to track and keep track of it. Think about whether it's a diary or those rating scales that Lisa mentioned, but how are you going to monitor if the medicine is making a difference for your child or not? Next slide. And then this is the summary. So, we know that anxiety is more common in autistic individuals. The symptoms of ASD and anxiety can overlap and make things confusing sometimes. Behavioral therapy, we know, is more effective, whether it's CBT or if it's a younger child or a less verbal child that maybe can't do traditional CBT, some of those parent approaches that Lisa mentioned, all of those strategies can help to teach the skills of coping with things that make someone anxious. And then medicines have side effects, but in some cases, they may be necessary to help maximize the benefits of the therapy that you're trying to do. And I think that's our last slide. Oh, resources. So we've been throwing resources into the chat. There is a really nice handout on anxiety strategies that you can use in autistic children. And there's a really great toolkit that I recommend to families if they're thinking about medicine or somebody's talking about medicine. There's a medication decision aid. It's like a little workbook that will walk you through what you want to ask your provider, what you want to keep track of, what you want to be thinking about if you're thinking of starting a medicine. And that's it. So we'll take questions.